The battle against Ebola in America. Here's what you need to know tonight. The nurse who treated Ebola patients in Sierra Leone is no longer confined to her home. A judge in Maine rejected that state's request to restrict Casey Hickox's movements until her 21-day incubation period ends. Maine's governor said in a statement today that he believes the judge's decision is, quote, unfortunate, but he won't challenge it. Hickox says that she's been self-monitoring based on the CDC guidelines and will continue to do so.
Well, in the past 12 years, the federal government has given $9 billion tax dollars to local health departments, specifically to deal with emergencies like an Ebola outbreak. So why have there been some high-profile missteps in dealing with the few Ebola cases in the U.S. so far? Cheryl Atkinson takes a look.
CDC Director Thomas Frieden has exuded confidence since the first U.S. Ebola case.
I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country.
But public confidence has been pierced by CDC's wavering protocols and changing assurances as one case has grown to 4.
What are the list of the mistakes that you've seen that we need to learn from?
Well, there are many.
Larry Gostin is a global health expert and Georgetown University law professor advising Obama officials on Ebola.
At the state, local, and even federal level, there have been a series of missteps that literally we cannot allow to happen again.
From a Dallas hospital discharging Liberian Thomas Duncan while ill to isolating his close contacts in his contaminated house. Gostin also points to an ill-prepared healthcare system that allowed infection of 2 nurses.
And then, of course, one of the nurses who did contract Ebola virus disease boarded an airplane. Another lapse in judgment.
At a hearing last week, a nurses' union official warned Congress serious gaps remain.
85% of the nurses say they are not adequately trained and the level of preparation for Ebola in our facilities is insufficient.
All that despite billions of tax dollars spent. In 2006 alone, Congress gave the Department of Homeland Security an extra $47 million for pandemic readiness. But a new audit found the agency didn't know what equipment it had, where it was stored, or if it even worked. Nearly all of the TSA's 200,000 respirators are expired.
In fact, the department believes that their entire stockpile of personal protective equipment will not be usable after 2015.
Top Democrat Elijah Cummings says the bureaucracy is learning from its mistakes.
It appears that healthcare authorities have come a long way in preparing for Ebola since Thomas Duncan first walked into a Texas hospital last month.
Gostin says the CDC must improve the patchwork response in U.S. cities and states that have no experience in dealing with such a virulent and lethal virus. Investigating Washington, I'm Cheryl Atkinson reporting.